when I was about 15 years old, a good friend of mine, his father had a pretty rare neurological disease called Guillain-Barré syndrome, and we were literally one day riding our bicycles, did about a 10-minute bike ride, and the next morning he woke up paralyzed from his waist down, and the day after that he was paralyzed from his neck down, and he was in that position for about a year and a half without being able to move any of his muscles. And I basically felt like I went through this process with them because he was one of my closest friends, and I used to visit his father at the hospital a lot, and obviously he was receiving a lot of physical therapy. And just by being around the hospital, and I started volunteering there when I was a little bit, about 18 or so, and it sparked my interest, and I knew it was the right profession for me. We have a few things that are unique, I think, compared to other facilities. Number one, I think our open communication. We're very, very open with each other. It's always an open door policy between myself, Dan, and the rest of our staff. Always willing to listen to whatever anybody has to say, whether it be good, bad. We're there for them, and I think our staff as well. I think they communicate very well together. So I think that's one of our strengths. Another strength, I think, is we've created a very positive environment in which it's a nice place to come and work. We have a very vibrant staff of therapists and administrators, and I think we have a very cohesive staff, and it's fun to come to work, which I think is unique in many environments. So I think that's number two. Personally, I've always had a need to help people, whether it be in a health-related field, helping my son with his homework. I like to help, and I like to be involved with people, and I think that's what makes me successful in what I do. And then, of course, there's the sports aspect of physical therapy. I'm very involved with athletics and always have been, and I think there's a nice connection between what we do in the clinic and what I do outside. So it seems it's just a very nice match, brings everything together. I started Spear with Dan. So the story is essentially that myself and Dan went to school together, and we figured if we could sit next to each other 8 hours a day for 3 years that we could run a business together, and in turn we were right. It's worked out great. And I was getting ready to actually move to Colorado. I was going to go actually to the Sydney Olympics, and I was going to volunteer at the Olympics like I did at the Atlanta Olympics in 1996. And after the Olympics, I was going to come home, pack up, and move to Colorado and be a ski bum / physical therapist over there, and probably never return home. And then Dan called me up one day and asked me if I wanted to start a practice, and I said yes, and the rest was kind of history. We had no idea how to run a business. All we knew was how to treat patients and that we wanted to have a business, and we slowly learned the ropes. We had one treatment room with our computers, with our phones, and that's where we did all of our work. And we had a company that was nice enough to give us 6 months of time in that room before we needed to start paying rent and getting more of a business situation, and we really made the best of it. We grew the business and learned how to deal with insurance, how to deal with patients. We hired our first person after I think a year, which was very exciting, and it was really a nice growth process.